Cervical vertebrae. Your neck holds 7 cervical vertebrae, small, strong, and vital. In this video, we'll quickly break down their typical and unique features. Let's get started.
Cervical vertebrae. There are 7 cervical vertebrae, numbered 1 to 7 from above downwards. They are small in size as compared to thoracic and lumbar vertebrae, as they have to carry less weight. They are identified by the presence of foramen in their transverse processes, called foramen transversarium, the cardinal feature of cervical vertebrae. The 3rd to 6th are typical because they have common features. The 1st, 2nd, and 7th are atypical because they possess special features for individual identification. Features of typical cervical vertebrae. The features of typical cervical vertebrae are as follows. The body. It is small. It is broader from side to side than from before backwards. Its superior surface is concave transversely, with upward projecting lips on each side. The inferior surface on the anterior margin of the body projects downwards in front of the intervertebral disc, while the lateral margins are beveled laterally to form the synovial joints with projecting lips of the vertebra below. These are called uncovertebral joints, joints of Luschka. The vertebral foramen is triangular and larger than the body. The superior and inferior articular facets are flat. Superior facets are directed backwards and upwards. Inferior facets are directed forwards and downwards. The transverse processes are small and pierced by foramen transversarium. Each process has anterior and posterior roots, which end in tubercles called anterior and posterior tubercles. They are joined together by costotransverse bar. The costal element consists of anterior root, anterior tubercle, costotransverse bar, and posterior tubercle. The posterior root represents the transverse element of the developing vertebra. The spine is short and bifid. Features of a typical cervical vertebrae. First cervical vertebra. The first cervical vertebra is called atlas because it supports the globe of the head on its shoulders. According to Greek mythology, the Atlas is the god who supported the globe of Earth on his shoulders. It has following features. It is ring-shaped and has no body and no spine. It consists of right and left lateral masses connected by a short anterior arch and a long curved posterior arch, and right and left transverse processes. The anterior arch is marked in the median plane by the anterior tubercle on its anterior aspect and an oval facet on its posterior aspect for articulation with the dens of the 2nd cervical vertebra to form atlantoaxial joint. The posterior arch forms 2/5 of the ring, and its posterior aspect is marked by a median posterior tubercle. The upper surface of the posterior arch behind the lateral mass is marked by a groove which lodges the vertebral artery and the first cervical nerve. The lateral mass presents the following features. Its upper and lower surfaces bear superior and inferior articular facets, respectively. The superior articular facet is concave and elongated. It is directed upwards and medially to articulate with the corresponding condyle of the occipital bone to form the atlanto-occipital joint. The inferior articular facet is flat and circular. It is directed downwards, medially, and backwards to articulate with the corresponding facet on the axis vertebra to form the atlantoaxial joint. The medial surface of the lateral mass is marked by a small roughened tubercle to provide attachment to the transverse ligament of the atlas. The transverse processes project laterally from the lateral masses. They are strong and larger than that of other cervical vertebrae. The elongated transverse processes act as efficient levers for the rotation of the atlas vertebra. The most important feature of atlas vertebra is the absence of its body. The body is absent because during development, the centrum of first cervical vertebra gets fused with the centrum of axis to form the dens. Thus, dens of axis vertebra represents the body of the atlas vertebra. Second, cervical vertebra. The second cervical vertebra is called axis because the atlas rotates like a wheel around the pivot provided by the odontoid process or dens of second cervical vertebra. It has the following features. It possesses a strong tooth-like process projecting upwards from the body called odontoid process. The odontoid process represents the centrum, body of the atlas. The dens articulate anteriorly with the anterior arch of the atlas and posteriorly with the transverse ligament of the atlas. It provides attachment to the apical ligament at its apex and on each side below the apex to the alar ligaments. The prominent anterior margin of the inferior surface of the body projects downwards to a considerable extent. The spine is massive. It is large, thick, and very strong, and deeply grooved inferiorly. Its tip is bifid. The transverse processes are very small and lack the anterior tubercles. The foramen transversarium is directed upwards and laterally. The laminae are thick and strong. The superior articular facets on the upper surface of the body extend onto the pedicles. The massive pedicle overhangs the foramen transversarium laterally. The superior articular facet is large, flat, and circular. They are weight-bearing and encroach on the side of the body. It is directed upwards and laterally to articulate with the corresponding facet of the atlas. The inferior articular facet lies posterior to the transverse process and is directed downwards and forwards to articulate with the third cervical vertebrae. Atypical features of first, second, and seventh cervical vertebrae. First cervical, atlas. Absence of body, absence of spine, long transverse processes. Superior articular facets are concave and elongated. They are kidney-shaped. The inferior articular facets are more or less circular. Second cervical, axis. Presence of odontoid process. Transverse processes are small and lack the anterior tubercle. Anterior margin of the inferior surface of the body projects downwards to a considerable extent. Foramen transversarium is directed superolaterally. Inferior surface presents a deep and wide inferior vertebral notch, placed in front of the inferior articular process. The superior vertebral notch is shallow and is present behind the superior articular process. Seventh cervical, vertebra prominens. Spine is strong, long, and not bifid. Transverse process is relatively long and lacks the anterior tubercle. Foramen transversarium is relatively small. Seventh cervical vertebra. The seventh cervical vertebra is called vertebra prominens because its spine is very long and forms a prominent palpable projection in the lower part of the nuchal furrow. The features of the seventh vertebra are as follows. Its spine is thick, long, and nearly horizontal. The transverse processes are comparatively long and large and lack the anterior tubercles. The foramen transversarium is relatively small and does not transmit the vertebral artery. It transmits only accessory vertebral vein. Carotid tubercle. The anterior tubercle of the transverse process of sixth cervical vertebra is large and called carotid tubercle of Chassaignac because the common carotid artery can be compressed against it, medial to the anterior border of sternocleidomastoid muscle. Hangman's fracture. Luschka's joints are commonest sites of osteophyte formation. Klippel-Feil syndrome is a clinical condition in which cervical vertebrae are fused and deformed congenitally. The congenital fusion of ring of atlas vertebra to the base of the occiput is called occipitalization of atlas. It is one of the most common abnormalities of the upper cervical vertebrae.
That's a quick look at your cervical vertebrae. Like, share, and subscribe for more easy anatomy insights. Thanks for watching.